like we're still a little bit short.
Yeah, we gave it a few.
So,
give it another 2 minutes. Yeah. Hopefully we can. Just as my eyes are adjusting, people's names pop around. I can't keep it straight here. But Bob and Sue, what's your first trip? Scheduled in July. Where are you going?
Mine will involve a golf course.
Golf course?
Yeah.
All right.
Sue will do something much more exciting.
Hardly. I don't, at this point, it's just going to be enjoying, not going anywhere. And then we'll go from there.
Remind me again, Ali, what's our total count?
we need 7, so we're just 1 short. So hopefully Enrique will pop in here any moment.
Bill, just to let you know, I have to jump out of the meeting early. So I'll be here through all the action items. So you make sure you've got a quorum for those, but I'll need to leave.
Okay, perfect. I think I see Enrique.
Good afternoon, everybody.
Yeah.
All right, Enrique's here. So I think we have enough.
I think we have a quorum. Good morning or good afternoon, Enrique.
Here we are. Hi, Ali. Hello, board. It's 1:02, so I guess we get started. Awesome. All right, I see a head saying yes. So you see the agenda today, and we'll started. And as you all know, Tom is our former chair, retired, so we'll need full quorum as we start the meeting today. So I'm acting as vice chair to officially start our meeting with the assistance of Ali and the team. So the first thing we'll do before we approve the minutes, is that correct, Ali?
You can go ahead and do the minutes and then do the board chair vote. Yeah.
Okay, so we'll approve the board minutes that were sent to you via email, and this is our attendees for that meeting. And if there are any corrections that need to be noted, please let us know for Rose to make their proper modifications. So that meeting was on May 7th online. So are there any corrections or suggestions that need to be made?
Move to approve.
I move. I second.
So, all right, so everybody's excited to call the question to approve the minutes from May 7th. So all those in favor say aye.
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 All right, no objections. Thank you. So we have approved the minutes for May 7th, and now we can start our meeting for the next part of the agenda, which the agenda is to approve board affirmation of officers. Ali, you want to speak to that?
Yeah, so you might remember last meeting we had 2 nominations to take over for Tom for chair. This is for the next year and was initially JJ's 2-year term. So this would be to take over for the next year. And we had Bonnie and Bill nominations, and after the meeting, Bonnie decided against accepting the nomination at this time. So since we have a nomination on the floor, we just would need vote for Bill for board chair for the next year.
All right,
I
so
move to approve Bill as chair for the next term.
And I will second.
all right, so Monty has moved the question and Bob has second. Without objection, do we move for Bill to be the chair? Or do you want to do the roll call, Ali?
Yeah, sure.
Okay, I can do the roll call. So we'll just do roll call for the approval to add Bill as our chair for the remainder of the 1-year term. So Cheryl,
Yes.
Michelle,
Yes.
Dewberry, Michelle.
Yes. Sorry.
Hi, Sally,
Yes.
Bill,
Yes.
Bonnie,
Yes.
Susan, Miller, Susan,
Yes.
Rick Smith, Susan,
Yes.
Robert Young,
Yes.
and myself, yes. So motion carries. We have approved Bill to be the chair for the 24-25 OEB board year. And we'll go back to our agenda, which is the next part. Ali, you want to speak to the next part?
Yeah, you can just hand it over to Bill now and Bill can run with it.
Perfect. So it was a pleasure to be your chair for 2 minutes, the fastest chairing part of this OEB history. So Bill, take it away. Congratulations, Bill.
All right. All right.
Thank you.
First, thanks everybody. It's an honor to be able to fill out the rest of Tom's term for OEB. I'm looking forward to a successful year coming up. So we'll just move right along if nobody has any questions. So we're starting with going to rulemaking process for an OAR Division 40 update. Presenter is April Kelly.
Good afternoon, everyone. I'm Linda Fries. April's out today, so I am going to fill in for her. I am the benefits manager for OEB and PEB. So we are in the process of trying to update our Division 40 rules. And part of the background, this is our largest division. Some of the things that we're wanting to do are make some updates so that OEB and PEB rules are more in line, especially with the upcoming new system. So some of the big highlights about the Division 40 rule change is the wash the baby rule for newborns and adopted children. We are removing that aspect of the rule and bringing in the first 31 days of free coverage. And so this aligns OEB and PEB. If members want to continue to cover newborn or newly adopted child after the 31 days, they need to do a qualified status change or a mid-year event to permanently add the child to coverage. So those are one of the updates. The second one is removing the phased out approach to guardianship for grandchildren. April and I talked about this last week. We're not really sure even where this language came from. Right now, OEB members are able to add grandchildren if they are the court-ordered legal guardians. So we really just want to clean up the rules and remove this type of language. If we decide to align with PEB sometime in the future, then we may bring in more language that talks about adding grandchildren, maybe with an affidavit. So more to come on that, but at this point, it's just taking out language that really hasn't been used over the years. Another one of the big changes that's taking place effective October 1st is removing the 12-month wait on the dental plans. We've had the 12-month wait on the dental plans since open enrollment 2009. So it's kind of threaded all throughout this rule. So there's a lot of edits in the rule where we're just taking out that 12-month wait. Effective October 1st, everybody will roll to a whole dental plan that currently has the 12-month wait. And from open enrollment forward, everyone that enrolls in a dental plan will have a whole dental plan. Also, just some qualified status change language to kind of get us more in line with OEB and PEB, just kind of consolidating our rules and making things kind of marry up. So it's just some housekeeping with that. And then updating the declination of coverage to include veterans and Indian Health Services as areas where members can opt out of coverage. So those are the main things. And so what we're asking for the action is just for you all to approve all of this and let us move it to the permanent rulemaking process. Did anybody have any questions?
Okay, opening the floor. Anybody have any thoughts or questions? If not, I'll take a motion to approve the rulemaking process for Administrative Rule OAR for Division 40 enrollment.
So moved.
Moved by Sue.
I'll second.
I heard Bonnie, then I heard a bunch of other things. We'll go with Bonnie. All right, motion and a second on the floor for approval of the Division 40 enrollment rules as presented. All in favor, say aye.
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 Anyone opposed? Any opposition? All right, we'll pass that unanimously then.
All right,
All
thank
right,
you
is
all.
that it, Linda? Linda, is that all
That's
you
it.
needed? Okay.
That's it.
All right, before we
Thanks.
move into the next session, I realized I neglected something here, and that is I wanted to say something before we started, that just wanted to acknowledge that this is Bob Stewart and Sue Ricky Smith's last OEB meeting. I want to thank them for their service and the amount of time, especially in the work of presenting themselves as district leaders in our thing. So so happy to see you moving on into your retirements. A bit jealous. I'll get there sooner than later, right? But thanks again for your service to OEB. All right. With that said, we'll move on to the next section, which is the customer satisfaction survey results by Aaron and Cindy Mercer and staff.
Hi, everyone. Cindy Bowman. For those who don't know me, I'm the Director of Operations for OEB and also PEB. And I think we're going to start first with open enrollment communications, and then we'll move on to the customer service survey results. So we're kind of tag teaming both sides. So you'll see Aaron Ward on also. And my communications staff, I think, are on the line and are going to help me field any questions you have that I may not be able to answer. So Rose, if you can go to the next slide. So we're just going to talk about a few things today: passive open enrollment, give you some dates and deadlines, look at our communications, and then a couple of our tools. Rose, you can please move. Next one. Okay, so passive open enrollment, that's the big deal this year. With, as Linda mentioned earlier, with our new system proposal, we're doing a lot of work on that. We've got testing, we're building requirements, all of the things. And so it's a lot of work for staff here. And so we had asked board leadership if we could make open enrollment passive this year, which just simply means it's non-mandatory. So translated, if members are happy with what their current plan benefits are, they don't need to go in and enroll. This is not just for us, but we get asked by members all the time, why do we have to go in and enroll? So they should be happy this year that they don't need to. A couple things about that though, if an employer, if certain entity requires members to go in and enroll, they'll be communicating that to their members and they will need to go in and complete their enrollment. If they're a new hire or they need to choose a new plan because their entity has eliminated a plan, then they would need to go in and complete enrollment. But ideally, for the most part, the majority of our members will not need to go in and log in and enroll unless they want to. Next slide, please, Rose. So again, an entity can choose to have a mandatory open enrollment. We are communicating, which we'll talk about a little bit in our materials, that it's passive, but we're also making sure that members know that their entity could make a different decision and require them to go in. So we will say that, but we will have the entities will really be responsible for letting their members know if they're going to require them to go in and do enrollment. So thanks, Rose. So we have already started kind of the process, been busy for a while. So we did send initial notices out to entities. They've had their insurance committee meetings, and now they're in their decision period, so they can decide which plans they're going to offer for their specific members. In mid-July, we'll send our initial notice out to members and give them all of the information, or a lot of the information that they're going to want for enrollment. And then, of course, the enrollment period is August to September, kind of mid-month to mid-month. And then, as you know, benefits are effective on the 1st of October. Next slide, please, Rose. Okay, so we're right in the middle of communicating things out. Well, I shouldn't say we're right in the middle of it. We are right in the middle of preparing communications to go out. So in May, we did send an email to entities and got the benefits summary PDF and the rates out there so that those were available. We also, with the help of the Mercer Health team, created a renewal summary, and that has gone out to interested parties. And I hope you board members all received a copy of that. If you didn't, please let me know. You are the most interested parties, I think. And then we've updated, and by we, I mean the Mercer team has updated the online plan comparison tool. So that's ready with our current plan updates. So in June, we will have a webinar for entity admins that just kind of getting ready for open enrollment. That's late in June. We've already established the date, and I think the webinar has been, it's set up, and I think we've announced it to our entities. And I was just working with Sarah and Forrest, who are on my communications team, on the posters this morning. So those are going to be available for entities to print and put up in their buildings to remind people of open enrollment. Then in July, we'll have what we call a sneak peek email that goes out to members and gives them some basic information. Certainly not all of the details, but kind of, as it says, a sneak peek of what's going to be going on. The benefits guide should be ready in mid-July. The team has been working hard on that, and we're working with our designer right now to, I believe we've already gotten back the initial comments from Mercer to update, you know, specific to this plan year. And then we're working with our graphic designer to get the design elements set up. So more to come on that. Explore Your Benefits is a tool we're going to talk about in a little bit. That should be updated and ready to go by mid-July. And then we have what we call a heads up postcard that's going to go out to, it actually gets mailed out to members, reminding them that open enrollment is coming up. And then in early August, everybody gets a personalized letter to their home, includes rates, and gives them some basics about where they can find their resources for open enrollment if they want to go out. So it actually has a lot of links in there. We also include required notices and things like that in this letter. It's specific to each member because they will each have different plans from which to choose. So we can't just send a blanket generic letter because each entity selects different plans for their members. They will also have summaries, benefits available to them. So that's the big plan spreadsheet that has side-by-side comparisons. And then open enrollment starts in August. We'll do an open enrollment webinar shortly after the beginning of open enrollment, and that's for all members to join if they're interested in getting information about the different plans and benefits. And then, of course, we'll send reminder emails out through open enrollment. Remember to do your open enrollment. Not quite as big of a deal this year because it is passive. So if members don't go in and enroll, there's not really a penalty for that. But we will send them regardless and just remind them this is the one time of the year that they can go in without a qualified status change and make plan changes. As members do change their enrollment, they will get a confirmation email from us. And then after post-open enrollment, we will let them know if they've missed their enrollment or they've saved it, but they don't have an email address, then we'll send letters to their home. So next slide, Rose. So we have this super cool new tool. It was new last year and has been updated for this year. This is something that members can go in and fill out some information specific to their own situation and compare different plans so they can make a decision on what plans to enroll in if they decide to change. So I think that we gave you the link last year to go in and check, and we'll put it in the chat for you here. And if you'd like, you can go in and we can play around with that. So you can see how it works. I think Erin, you might have done a demo for them last year, and if anybody's interested in seeing that, we could do that also. That is in both English and in Spanish. And next slide, please. Explore your benefits. This is also a new tool as of last year. It's kind of a sort of like a video game where members can go in and learn things about their benefits. We got really good feedback about this tool last year. It has some educational videos, knowledge tests, and they're working on updating that for this year. Something I'm going to let Erin share here, but this is actually an award-winning tool as of about a month ago, I think, and I'm going to let Erin talk about that.
Thanks, Cindy. So for Explore Your Benefits, so the tool that the image that you're seeing on the screen, OEB won 4 communicator awards for this tool. The awards are really highly esteemed in the world of communications and marketing, recognizing excellence in creativity and innovation. The 4 awards that were won in the category of employee and internal communications won 2 awards of distinction for benefits and just general communications, and then won 2 awards of excellence for app or website and an employee engagement program. So this is very exciting news, and hope we're going to be advertising it to everyone because we're all really proud of it and really excited by that.
Congratulations on that. That's excellent.
Thanks.
Thank you. Yeah, it's we really received a lot of positive feedback about it also. Okay, next slide, please. Okay, so in addition to open enrollment communications, which we're really focused on right now, we, of course, communicate with members throughout the year. So we have our monthly benefits and wellness newsletter, and I don't know if you've had an opportunity to read any of those, but I think we copy you on them, and I would encourage you to do so. There's a lot of good information that we provide, and it's kind of evolved over the last year or so. And we really try to take member feedback into consideration. So we've kind of changed the design based on some member feedback. The topics are very much member oriented. So if members want information on specific topics, we add those, and we really do a lot of research, and we work with Erin and her team to get those newsletters out each month. Along the same lines, we have the monthly learning and event calendar, and we work with the carriers. So those are webinars and other resources that we have available for members each month, and that does go out monthly. The interactive wellness resource guide, that's posted on our website right now, and it's a really great tool. We update it each year for the new wellness programs, point solutions, things like that, along with the wellness programs that our carriers offer. And it's interactive, so people can move around and look at what they're specifically interested in seeing. We have a new hire video, or will soon have a new hire video that's going to be launched soon. So just as in the title, it's specifically for members who are coming into OEB, so they can get a view of what their benefit offerings are and some good information so they can make decisions. And then we have the member services and vendor partner surveys and reporting, which the member services survey is the one that Erin and I will be going over, mostly Erin, after this. The vendor partner survey is something that used to be part of the member services survey, and we pulled out questions that we used to ask in that survey and sent it specifically in the summer, and asked just about how people feel about the services that they're getting from our carrier partners. That, just a heads up, is not going to go out this summer, because we've also done a well-being survey, I think is what it's called, the well-being survey that went out to all OEB members as well as all PEB members, and we're concerned about survey fatigue for one thing with our members, so we don't want to inundate them. So we're going to focus on the member services survey this year, and also that well-being survey, and then next year we'll bring back the vendor partner survey. And next slide, please. And that's it. Questions or?
I have a learning question. This is not just on a side note, I guess, but I said just I wanted to curiosity. So last year we had the Corvallis School District, and this year we have a district down in Southern Oregon that are joining OEB. Do we do special work, especially in the first 2 years? Corvallis, for example, is going through their first full renewal. Last year they were joining. Do we do special work when we have large districts coming in?
Linda may be able to help answer that better. And if Georgianne is on the phone, or I'm not sure if she's here. From
Cindy,
a communications person. Yeah, go ahead, Linda. Yeah.
Okay. Hi, everybody. It's Linda again. So we work whenever new entities come on with us, we work closely with their HR and payroll departments to onboard everyone. The carriers are alerted, and the carriers really go down, I think, and are available to do in-person meetings if they need to talk about the new benefits. And we're available if they want us to do just a group conversation with them about how to do open enrollment, the new hire. The entity that's joining us from Southern Oregon, our goal is to get them, get everything ready and to go in the system so that they will be pulled and categorized into all of our open enrollment literature and mailing. So they'll be right there with the rest of the OEB group. So of course, if they need any special attention, we're right there for them if they need that.
It popped in my head because now in their second year, which would be Corvallis' second year, this is the first time they're doing full, just open renewals, and just do they understand everything? Do they have all the information they need? Do they get extra help as their people are doing renewal for the first time? Just asking. It's just more for my education.
All right, sure.
I don't see that Georgiana's on the phone, but I do know that when entities reach out to us, she is always willing to go out and meet with them or even have virtual meetings with them. She's done that with several. So I'll put a bug in her ear about that, and maybe she'd like to reach out to the school district and see if they need any help this year.
That is being friendly, right? Especially to our new entities. Right.
Absolutely, yeah. Mm-hmm.
Ollie, I saw your hand go up, but I don't know if you were wanted anything.
Yeah, Linda pretty much covered it. Georgianne's on vacation. She's our liaison with new school districts, and local governments, and she has a full onboarding process that has a big checklist of all the different things. Communication's definitely at the top of the list, but I mean, there's system issues, benefits, all kinds of different things that we walk through with them and kind of hold the hands through the first open enrollment, probably the second or third too. But yeah, it's exciting.
Yeah.
We have another school district group coming in through Central School District who's starting in October, about 150 educators. So yeah, it's really exciting to see OEB expand rapidly.
Central is Independence, right? It's Independence,
Yeah.
Oregon, I think. Yeah.
Yep.
Monmouth and Independence. Cool.
Yeah.
Oh, nice. Excellent. Any other questions from the board on communication, open enrollment communication plan? All right, hearing nothing, let's go to the next section, which is the customer satisfaction survey, which I said backwards. So this will be Erin and Cindy.
Yeah. So I'm going to give you just a little bit of background, especially for those board members who haven't been around very long. And then Erin and Teslin are going to kind of go through the results with you. So this survey actually started as a result of something we called the Oregon Progress Board. I don't know, it's been around for 15 years, something like that. It's quite old. Anyway, the idea was that that all state agencies should be checking the same elements of customer service across their membership, so that and it was specifically a legislative request at the time. So as we go through these first survey results, the first, aside from the demographic questions, there will be certain questions about accuracy and just left my brain, but you'll see the questions. There's 6 of them. They're asked in the same order. Rose, maybe you could go to the next slide, and I think it's going to cover demographics, so it's not. Anyway, as we go through it, we'll look at those results, and we'll be able to tell you kind of year over year. We don't give specific results, but kind of how it compares to the last year or so that you can see whether service is improving or, for the most part, I think it stays the same. So we ask these questions. We go out and survey members. We're getting ready to do our next survey after open enrollment, right? Generally closely following open enrollment, we send out the survey. I do want to point out it's not specific to open enrollment itself, but the services that members have received throughout the year. If they call Linda's benefits team, or if they reach out to our communications team and want something, or they have input about the website, there's lots of opportunities to provide feedback. So Erin, I think I'll let you take it from there and then help answer questions as we go through.
Yep, sounds good. Thanks, Cindy. All right, hi everyone. So just a little background on the survey before I jump into the slide that you see on the screen. We conducted the customer service survey from November 13th to December 8th, 2023. And for last year, we had 9,308 respondents, which was about 500 respondents higher than we had received when we conducted the 2022 survey. So then for the executive summary that you're seeing on the slide here, looking at these categories, in terms of satisfaction with OEB staff, we did find that there were higher rates of satisfaction this year by about 1 to 2% in each of the categories. So 93% of respondents were found that OEB staff were helpful, 92% believe OEB staff is knowledgeable, and 91% find that the OEB staff relay correct information on their first attempt. All positives. And again, these are just slightly higher than what we've seen in the past. In terms of satisfaction with communication, members are satisfied, or 92% satisfied with the methods of communications used. 92% are satisfied with the frequency and the content and the effectiveness. And then 87% prefer email communications, which we always find interesting, and we'll talk more about that when we get to that slide. In terms of the website, the responses last year were aligned with what we saw in 2021 and in 2022, with 91% of respondents being satisfied with the content, 85% being satisfied with the organization of the website, and then 90% being satisfied with the benefits enrollment system. So that's the oebenroll.com site. We also do have some demographics here. So we do ask a number of demographic questions, but we've included just some highlights here. And on the next slide, I'll get into a little bit of detail about how those demographics compare to the broader OEB population. So for this, or for the 2023 survey, most respondents had been with OEB for more than 11 years. Most identify as female and are in the 55 to 64 age range. Most respondents are represented and work for this, I'm not sure. I said represented. I'll leave that there. And then most respondents live in Marion, Multnomah, or Washington counties. So I'm going to go to the next slide. So like I said, we ask broader demographic questions, but in this slide here, we're comparing them against the full OEB population. And these are the only 4 things that we're able to compare. So that's why we included them here. So again, member tenure, again, members with longer tenure, so 11 plus years participated in the survey, which is higher than members or like the general OEB population. A higher proportion of females responded compared to the overall population. The ages of 18 to 44 participated at a lower rate than those of ages 45 to 64. And then in terms of locations, these were generally aligned with most respondents living in Marion, Multnomah, and Washington counties. So that's kind of the high level demographics. We'll get into the specific questions, and I'll turn that over to my colleague, Teslin Ishii. Teslin has been very instrumental in the administration of the survey and pulling together this report, so she'll go through the detailed slides. And then we'll have time for questions at the end, but please do jump in if you have questions as we are looking at each question.
Great. Thank you, Erin. Yeah, we'll go ahead and go to the next slide. Thank you. So these next few slides are going to show the real detailed survey findings by question. So just to orient you to what the slide looks like, we have the main question kind of running in bold at the top. We have a nice blue box that summarizes the key takeaways from each slide. So I'll kind of be highlighting those as we go on. And we use colors to show the exact responses from members that we received for those questions. So as you can see here, the green is on the left, which denotes very satisfied. Blue is satisfied. The yellow is dissatisfied, and the aqua is very dissatisfied. And then we have the percentages running along the left of the graph that show the percentage of responses in a given category. And then if there was specific categories that we asked about in a question, those are running along the x-axis, as you can see here. So to start, for this question, we asked, how would you rate your customer service interaction with OEB staff in terms of the timeliness of services that were provided, the ability to provide services correctly the first time, the helpfulness of staff, the knowledge and expertise of staff, the availability of information, and then overall service. So you can see we have really great numbers for the green and blue bars. So most respondents who had interacted with OEB staff say that they were satisfied or dissatisfied with their I apologize, I misspoke. They were satisfied or very satisfied with the interaction across all categories. And as Erin noted, there was an overall increase in satisfaction ratings from 2022. So that's really great to see that tick up a few percentages across the board. And then let's go ahead and go to the next slide. We asked about the website. We asked members what their satisfaction was in terms of OEB's website when considering the content, so the information that's on the website, and also the organization, the ease of them being able to find what they're looking for. Here, members report being either very satisfied or satisfied with both the content and the organization, with the highest percentages being satisfied with that really big blue bar that you can see. The results for the website satisfaction are very similar to those that we saw in 2022. And then let's go ahead and go to the next slide. We asked about their satisfaction with the MyOEB benefit enrollment system found at oebenroll.com. Here you can see we just asked if they were satisfied or dissatisfied. So a huge percentage, about 90%, say that they're satisfied with this system, which is very aligned to, again, what we saw in the 2022 survey, which is great. Moving to the next slide, the next few slides, we talk specifically about communications that are coming from OEB. So we asked people how satisfied they were in terms of communications from the past year, specifically in regards to the methods that were used. So whether that communication is in the form of an email, a home mailing, the digital tools, PDFs, etc., as well as the frequency that they received those communications, the content, so what was being said and how it's being said, and then lastly, the effectiveness, so really getting to the fact, really asking members if they understand the communications. You can see, again, really great numbers across the board. People are super happy with communications, with most respondents being satisfied or very satisfied across all the categories, with the results being very similar to 2022. To a more detailed communication slide, we asked specifically how members would prefer to receive information from OEB. You'll see that the top response by a wide margin is through emails. And Aaron kind of hinted at this earlier. We find this slightly interesting because you will see later that when we give people the option to write in feedback, one of the top written responses is often that people feel negatively about how many emails they receive and they wish they didn't receive as many emails. So this is indicating a little bit to us that maybe in terms of email preferences, we have members on either end of the spectrum when it comes to email communication preference. Note that this response is consistent for what we saw in 2022, so that's not surprising. And we also saw that the website was the second most preferred method of communication in both of these years. I want to draw attention to the newsletters, which is right in the middle of the graph there. The newsletter option was added this year, so we didn't ask about that in 2022. And we're pleased to see it being the third highest overall preference with about 2,000 votes, because as Cindy and Aaron talked, or as Cindy talked about, OEB has really been focused on putting out letters or newsletters each month that focus on a variety of topics that are appealing to a broad spectrum of members. So we're really pleasantly surprised to see that that communication channel is being prioritized and is preferred by members. And then bump to the next slide, which we asked a little bit more about their customer service interaction. So here, if a member contacted OEB during the year, we asked them what they contacted OEB staff about. You can see at the top of the graph, there were really two main issues that were significantly higher than the rest. And so these were members asking questions about benefits, information, and then also in open enrollment related questions. And we've been talking a little bit internally with Mercer about potentially the value of breaking down these categories further in future surveys to determine specifically what benefits questions people might be interested in learning more about. So for example, we might consider breaking down that first category, benefits questions, into medical plan questions, dental plan questions, etc., so that we can get a little bit more granular about what members are contacting OEB staff about. This was a new question that we added for 2023, so it's giving us also a little bit more insight, but we don't have that year-over-year comparison available for this question and the next few questions as well. And then I'll bump to the next slide. Next, we asked what areas OEB staff could improve accuracy when it comes to customer service. You can see at the bottom of the graph that most respondents are saying that OEB staff is very accurate. They don't need to improve accuracy in any of the categories that are listed on the left of the graph. For people who selected that other option, which is the second to bottom category, they were given the option to also write in a response. And the top written responses that we saw there were that members really had no interaction with OEB staff. So we'll consider adding that as a selection in the future to make sure that we're accounting for people who didn't interact with OEB staff. And then the majority of the other write-in comments didn't actually mention whether there was potential accuracy issues or how OEB could improve accuracy. So we looked for kind of some additional insights there, and we weren't able to gain them. The main write-in comments that we got was things like wishing open enrollment wasn't mandatory, that Cindy talked about earlier, potentially getting too many communications or improving the website. So overall, we didn't get any additional insight from the open responses, but this is great to see that people feel OEB staff is accurate and doesn't need to improve. We're considering rewriting this question potentially a little bit in the future as well, so that we can get a little bit more specific about if there are accuracy issues in the future. Again, we don't have year-over-year data for this specific question because it was new for 2023. And then moving to the last detailed survey question, this was just in general asking members what topics they might be interested in learning more about. As you can see, the top two responses were wellness programs and core benefits information, so the medical, dental, and vision plans. We found the wellness programs response being the top as pretty interesting because it aligns with what we've heard through some other feedback channels, like the vendor partner survey that Cindy mentioned earlier. We wanted to call out that there are several wellness program resources out there on OEB's website right now. Cindy highlighted there's a very comprehensive interactive guide that details all of the wellness programs by vendors and the point solutions, et cetera. But obviously, we're seeing that maybe people don't know how to find this specific guide, or they don't know about the programs, or they want more information about the programs. So based on this feedback, OEB has definitely heard this and has identified this as a communication priority for the future. So we'll be sure to focus on wellness programs available and the resources around those programs in the future. So that concludes the specific survey detailed slides, and I'll go ahead and turn it back to Erin to wrap up and talk about the write-in responses that we received from members.
Thanks, Susan. So we have here the top likes for the write-in. So at the end of the survey, we do ask a general question. Is there anything else you would like to share? And so we have a slide here that summarizes the top likes that we heard from people in those write-in comments. And the next slide is the top areas for improvement. And I'll just point out that you might see more areas of improvement than likes in terms of the numbers, which is very typical with any survey. Most people use the write-in spaces to provide negative feedback versus positive feedback. So the fact that we even have some positive feedback, I think, is great to share. But just know that this is very typical with surveys, including OEB's past customer service surveys. So for top likes that we heard in the write-in comments, in member services, we heard that they're getting good service, keep up the good work, that OEB staff is helpful. In the areas of coverage and benefits, we heard about that the coverage is good, there's no complaints with the coverage, they appreciate the number of options that are available, and then the third there is that people like having the Weight Watcher benefit available. On premiums and costs, we got the top comments was that the benefits were affordable, that they were a good price, that they were a low cost. And then we just had like other positive premium costs, which is there's a lot of random comments that we kind of code and put together as other when they don't really fit into broader categories. For enrollment, we heard enrollment is easy. We heard that the enrollment webinar is helpful and that it's good for preparing for open enrollment. And then again, we just heard a bunch of rather random other positive comments. And then we have a miscellaneous category as well. Generally, people felt happy, satisfied, or that everything was good with their OEB benefits. And then just other random positive miscellaneous comments as well. On the next page, in terms of the top areas for improvement, for member services, we heard, when we coded everything and put them together, we heard the theme around that the staff was not knowledgeable, that they were unable to answer questions. There was a lack of follow-up, or that the staff was slow to respond, and that there was just a general neutral feeling towards OEB staff. For information, they have questions about coverage. They want more information about benefits. Here's that point about the emails, that they receive too many emails, messages, and advertisements. So again, interesting that email is showing as a preferred response or a preferred method of communication when we're also getting a lot of write-in comments saying people that there's too many. And then lastly on information, just that the website is hard to use or navigate, or there's, like poor online service. And again, these are general comments. So we've taken everything and put them into like broad categories. For coverage and benefits, we have level of benefits have dropped, or that they want increased coverage of, generally speaking, they want more carriers or more choice of insurance companies, and they're having coverage issues with the gym and fitness or health wellness benefits. On premiums and costs, we heard premiums are too high, or they want to reduce the cost of premiums. Out-of-pocket expenses are too high, and the deductible is too high, or they want a lower deductible. And then that last category for enrollment, we want benefits to carry over or roll over automatically. They don't want to have to enroll each year, so hopefully they'll be happy this year. That is a passive enrollment, unless required by your employer. The second item there is that the enrollment website is difficult to use. And this is, again, referring to oebenroll.com, not oebinfo.com. And then lastly there, that information is unclear. They're unable to see the information, or they're unable to compare their benefits. So again, those are just the top areas for improvement, summarizing the write-in comments. So that's the detail from the survey. Robert, you have a question?
Yeah, I do. On this particular slide,
Mhm.
I see the rankings, but I don't feel the weight of it. I mean, is it like one or two people have said this? Because I going forward, I'd like to know, how, I mean, obviously we want to improve everything, but without knowing the relative weight of these comments, I don't know how to proceed.
Yep. So we do have the numbers, Robert, for like each one of these things for like member services number 1. We did take the numbers off, but we could add those back in and then share that with you so you could see like how many were categorized in number 1, how many were categorized with number 2, so that you can have that. And we'll send that back out then to everybody. So we can do that on the previous page as well as this page.
Thanks.
Mm-hmm. Any other questions? Just looking in the chat too. And Cindy, please feel free to jump in if there's anything else that you wanted to add. Ollie?
Yeah, thank you. I just want to say how proud I am of the benefits team, Linda's team. I don't know, I think what you were getting at there, Robert, I think can be seen in the earlier slides where 90 to 92% are very satisfied or satisfied in most of these areas. And working in OHA, I think I don't know that we've ever hit 90% for OEB, but working in OHA, if you get to 80%, it's almost never achieved. This team has been together since day one of OEB. These are absolute experts in our rules, our benefits, and I would throw the carriers who you'll hear from later that I don't hardly get any members forwarded to me, and that's always a sign of things are going very well. So I just really want to recognize the team and really how great of a job that they do and continue to do. Thanks.
Thanks, Ollie. I think that is definitely the theme that we take away from the survey results as well.
It has been my experience that people who are happy tend not necessarily to write things in, and people who are unhappy feel free to do that. So I agree completely with what Ollie said. Linda has an exceptional team, and so hopefully these comments don't lead anyone to think otherwise, because they do a really great job.
Yeah, and just want to be clear on these comments. These aren't, I guess these are in line with what we've heard in the past as well. There was nothing that was new or different, or the numbers weren't very skewed. Like this year, we weren't seeing tons more responses on certain items. So definitely in line with what we've heard in past surveys.
And we'll definitely share the exact numbers, but just so you know, it's about the most on this, I think, is about 90, as few as 10 people commenting on these. So percentage-wise, out of the 9,000 people who are responding to this survey, as you all highlighted in a very, very positive way, there's between 10 and 20 people who are responding-ish to these, just to give you a little preview to those exact numbers that we'll share too.
All right, very good. Any other questions from the board? Not seeing any hands up. All right, thanks for that presentation. I'll agree with Ollie as someone who was mayor for 6 years. I would have loved to have numbers like this, and never would get numbers in this range when you're in city government, right? So yeah, this would have been the dream survey results for me. All right. Wow. Just looking at the time clock. Nice. Let's just keep on rolling, right? We'll go right into John and Brian, if they're around for the EAP update.
Good afternoon. So just a quick update on the EAP. So the implementation is proceeding on schedule, and we have largely arrived at agreement in terms of the contract. So we're just going to show you where we've ended up in terms of the rates and the services. So and these are available on the OEB website. So here are the rates, and then you can kind of see the member services and the organizational support that are included in the rates, as well as the entity paid, which is on the lower part of the page. You can see what that, there's additional costs that, for entities for certain services around training. So those are the rates. And then there's also the services, a listing of the services that we'll bring up just so you can, and we'll, yeah. So here, and these are broken down. So some of the services, as you can see, are covered under the per employee per month rate. And that's what you see on these pages. And so you have that behavioral health support, resources for live, and then there's organizational support services to training and leadership support. And then similar to the rate pages, as we go further down, you'll see what the services are listed that are purchased separately, around organizational development and some trainings, as we mentioned. So again, things are proceeding well. Just a couple things to button up on the contracts. In terms of the performance guarantees, we have reached an agreement there, and there are 12 performance guarantees. There is 15% of fees at risk in year 1 and 20% of fees at risk in years 2 and 3. There's a scorecard approach to evaluating the performance guarantees. So the thing is, again, there are 12. If Canopy gets, passes or meets the performance guarantees for 10 or more, they retain all the fees at risk. And then there's a sliding scale, if they meet 9 or fewer of the performance guarantees. In year 1, there's a special performance guarantee around implementation, as you might expect. And then that particular performance guarantee is replaced by one around utilization in years 2 and 3. And again, there's a full expectation that there'll be an increase in utilization with the Canopy services. So let me just pause there and see if there are any questions.
Is this contract signed? Is this the deal, or are we still negotiating?
We're just, the contract has been shared back, so we're just buttoning down a few things, and then it should be signed fairly shortly.
Yeah, this is Brian. We've come to agreement on 99.9% of the stuff, including what's being presented here. There's some legal terminology and other things that we're still buttoning up, but nothing concerning or nothing impacting the actual programs or services being offered.
You got lawyers pulled out? Man. All right. I don't see any hands up. Thoughts, questions? Was that it, John, or were you?
That was it. Again, we were
Okay.
trying to keep it short. Everything's on track with implementation, and we're buttoning up the contract.
Okay. Don't see any hands up, so I'm gonna make some command decisions here as your leader. I want to shout out to Erica and Sapari. Are you guys prepared to do 50 minutes ahead of schedule? Is that going to be a problem for you, either of you? Erica first. Okay, I got a thumbs up.
No problem for me.
Yeah. Hi, Bill.
All right, I'm going to say let's go ahead.
Sorry.
Go ahead, Sapari. Sorry, I interrupted you.
No worries. I can definitely try to get our speaker in line for after Moda's presentation, after Erica's presentation.
All right, we'll take a break in between if you can't, right? So if everybody's okay, give a shout if you're not. I'm gonna just keep on rolling because we have we're pretty good on schedule. So let's just keep on going. So Erica, I believe you said you're okay to go, right? So let's roll with it.
Thanks,
So
Bill.
we're going to do customer carrier survey, customer survey from Moda.
This never happens where I feel like I don't have to rush through the presentation. So this is fantastic. Hello, everyone. My name is Erica Hedberg. I'm the Director of Government Programs for Moda. And I'll be providing just an update on some customer experience surveys we've done, as well as ways we are looking to really enhance our member experience. So next slide, Rose. So our member experience is really all within the framework of Moda 360. And I know most of you have heard me talk about Moda 360 before, but I know we also have some new board members on too. So I'm going to do a high-level overview. And for anybody who would like more information or details, please let me know and I can follow up with you as well. But Moda 360 is really aimed at a few different things. It's a program that really encompasses the entire way we really work with the member and their experience. So first, we're looking to deliver healthcare with context. So really tailored to each member. There's the human connection, which is the health navigators, which I'll go into on the next few slides. There's the point solution curation. And, as Mercer and OEBB were talking about with the satisfaction survey, there are a lot of programs available to our members. And it can be very overwhelming for members when they have a ton of different communications being sent to them. So we really try and tailor the communications that we send so that we are really trying to get the point solutions in front of members that are right for them, instead of trying to put all point solutions in front of the member. And then we really look at including all relevant member data. So members are more than just a diagnosis on a claim. We can see, a member may have diabetes, but there's so much more to them than just that. There's also where they live, any economic situations they have going on, clinical situations, and just everything else about who they are. So we really try and get as much information about our members as we can to really tailor the experience to serve all of them instead of just their diagnosis that we get on a claim. So next slide, Rose. So we're health navigators. This is our customer service for OEBB members. And OEBB really gets our best of the best customer service that we call health navigators. These are people who receive additional training, who are really encouraged to spend time with the member. I think that all of our customer service at Moda is great, but our health navigators are fantastic. Their job is really to take the member out of the middle of situations. So, for example, if members are struggling with issues with the way a claim paid, maybe a prior authorization that they're trying to get, or getting DME from a DME vendor. When issues come up, which can happen all the time at any point during this complicated process, members really don't know what to do. They don't know the right questions to ask. They don't know where to go, what they need, because they don't do this every day. But our navigators do this every day. And so they're really tasked with taking that on for the member. So instead of just giving the member information, for example, yes, I see that your PA was denied. It's taking it farther and figuring out, why was that PA denied? Was it denied because we didn't receive information from the provider? And if that's the case, then the navigator reaches out to the provider to really facilitate that. So really just trying to take the member out of the complication. Next step, or next slide, I mean. Right, and then in addition to really helping members navigate that, they also serve as the hub or the guide to connect members to resources and tools to help them. We really try and take every opportunity that we have when we're in front of the member to connect them to the right programs, the right solutions, maybe our healthcare services department. And so the navigators really serve as that hub to kind of facilitate that member and getting them to that next best step. And we really try and take every opportunity with that member that we can to get them connected. So next slide, Rose, please. And this slide just shows that the left side is showing the average risk score for members, and then that triangle is showing how many touch points that they have through our MODA 360 program. And a touch point can be either working with our navigators, working with our healthcare services team, interacting with our member dashboard, a lot of different touch points. And as you can see, members who have higher risk tend to have more touch points, which is exactly what we would want to see. Some members, we want to try and connect with all members, but it's really those members that need the additional navigation or connection that we really want to be getting in front of the most. And we've been able to see through our data that we've been successful in doing that. Next slide, Rose. And then we do like to ask our members about their interactions with their health navigators. So every time they call our health navigators, we invite them at the beginning of the call to take, if they want to take a survey after the call. And so after they go into the call, then they'll, after that ends, then they'll take the survey. And so this is the results from just this last quarter. The first pie shows the overall satisfaction with the health navigators. And that shows that 92% of members indicated that they were satisfied with the health navigator. The second pie shows their satisfaction with the health navigator's knowledge. And 98% of our members indicated that they were satisfied with the member's knowledge, which is great. So maybe sometimes they didn't like what the health navigator had to say or what the outcome was, but they are satisfied that they are getting the right information from our health navigators. Next slide, Rose. And it's one thing to see the numbers from how members are rating our navigators, but it's another thing to actually see what our members are saying about our navigators. And this is just a small sample of some of the feedback that we get from our members. A lot of times when members, they'll come into the call, they'll say they don't want to take the survey, and then they go through the call, but because of their experience, they want to write in and actually tell us what happened. So they'll send an email in afterwards or call and leave a voicemail. And this is the result of that. And it just really shows that members are satisfied with how the navigators are really navigating them through some of the complex situations. I know I have called companies before very frustrated. And so I can imagine the difficult job it is when navigators are, taking these questions of members who are really just trying to figure out what's going on. And it's nice to see that our navigators are really being able to help our members navigate through those situations. Next slide, Rose. Right, so now I want to transition a little into our personalization. So that's our navigators. And now I want to talk more about our member experience through our member dashboard. So this is a snip of an example of what it looks like when our OEB members come into their dashboard. And I've highlighted two tiles here. The tile on the left is our Behavioral Health 360 tile. And so MODA also OEB has our Behavioral Health 360 program, which helps connect members to behavioral health resources, and then also expands on the resources that members have available to them. And then the slide on the right is our MODA 360 programs. And I'm going to go over both in the next couple of slides, but I want to start really quickly with the MODA 360 programs. As I said, there are tons of programs available to OEB members. And what we do is we try and take all of the information that we have about members. So we take the claims data we receive, any clinical data we have, social determinants of health data that we get from members, and everything else that we have. And we take that and run it through what we call our personalization engine. And that identifies the top 3 programs that we have identified for that member. So this member right here, I know that this example that I gave you is a type 1 diabetic. And the reason that you'll see these programs here is because we know that members who have diabetes are more likely to have a comorbidity of anxiety and depression. So we weight the behavioral health programs higher for our diabetic members. So when this member's coming in, they've already engaged in our diabetic programs that we have, which is why they're not showing here. But it's suggesting behavioral health programs for the member because it's identified that that might be the best next step for them. It's also given them our comprehensive coordinated care program, or C3. That's a program that really is an invitation only program, so we don't advertise it, but we reach out to members who we've identified as kind of being at risk for someone who's starting to maybe come into utilizing the healthcare system more and maybe kind of losing control of managing their health. And so we'll bring them into the program. We ensure they're connected to a high quality primary care provider. And then we waive the cost sharing for primary care visits and mental health visits for them. And so this program would only show up for members who are eligible for the program. Not everybody is going to see that program if they're not eligible. So that's why those 3 programs showed up for this member. So now I'm going to shift back to the Behavioral Health 360 slide and go to the next slide, Rose. So that's personalization from data that we have about members, but we also do real-time personalization. And this example I'm going to show you is for the Behavioral Health 360 program. So if members click into that tile on BH 360, one of the things they can do within there is take an assessment. And the goal of the assessment is to try and identify the best solution or program or fit for that member. So it'll take the member through a quick assessment. It's going to ask members, what kind of therapy they're looking for. It's going to ask them a lot of the questions from the PHQ-9 and the GAD-7 to assess if they have anxiety or depression or are at risk for that. And then it's also going to ask them about different things such as OCD, substance abuse, things like that. And then after they go through the assessment, it's going to give them our suggestions for their for the programs that might be best for them for what they're looking for. So Rose, if you go to the next slide. This is an example of what the results will look like. So it says, based on your answers, we have 2 programs that could be a great fit. Otherwise, contact a behavioral health champion or browse all programs below. So for this member, based off of how they answered that assessment, it's recommending addiction care with Hazelton Betty Ford. So the member probably responded with some concerns around substance abuse. And then it's also giving them mobile therapy with Maru Health, which is a program aimed at anxiety and depression. So the results of their questions gave those suggestions. And then it's always going to also offer the behavioral health champion as a connection for members who may want some additional help finding the next resource or a different connection. And in addition to giving them the real-time results, we then take those answers and it feeds back into our personalized programs and our personalization engine. And then it helps rank those programs for that member because now we've received additional information from them. So next slide, Rose. This is just an example. If you clicked into the Moda 360 programs, in addition to the top 3, it's also going to give you all of the programs that we offer, and it lets members be able to search by topic. So this is an example of what it looks like if a member was looking specifically for mental health and behavioral health programs. So it's giving them just those programs. Members can search for things like fitness, wellness, virtual care, lots of different things. But we want to make it as easy as possible for members to be able to identify the program that's right for them. Next slide, Rose. This is just an example of what it looks like when they actually click into one of those tiles. So the small tiles had a short description of the program. When they click in, it's going to give them a longer description of the program. And then it's going to take them directly to that program's website. So they can click on Learn More and Enroll, and it's going to take them directly to Spring Health, trying to make it as easy as possible for members to get to that program and enroll, and not trying to take away as many clicks as we possibly can. And next slide, Rose. Great. And then now I want to shift over and start talking about something that we recently launched for Moda 360 and for OEB members, and that's our social determinants of health team. And this is a team of social wellness advocates, And like I said earlier, we know that what impacts a member is more than just the claim we get on the diagnosis. There's so much more going on with members. And sometimes those things can impact a member's ability to manage their health. And so this team, these advocates, work with members to identify and mitigate social needs that might be barriers for their health. One way they do this is through using the Unite Us platform and connecting those members with organizations that could meet their social needs. If you're not familiar with Unite Us, I'm going to do a very high level overview of it. It is a platform that that can be used where we can go in and enter information about a member, such as where they live, what their social needs are. And then it has just a bunch of different resources that could meet the needs of that member. And what's great about it is it has a closed loop referral. So you can actually issue the referral to that resource within the platform, and then it will close the loop. And so we can see if that member actually engaged with that resource. So this social determinants of health team is using Unite Us as one tool to help members close those social need gaps. Next slide, Rose. So how do we get members into this team? Well, there's a couple different ways. One is that they can be referred to the SDOH team, or they can self-refer. So navigators, if they're working with a member and they identify, hey, this member might need some additional assistance, they can refer them over to the SDOH team. We also will be outreaching to members based off of our health context score. Our health context score is essentially just our risk score that we use that includes not only claims and diagnoses, but also our SDOH data. And that score indicates that the member might have high social needs. And so based off of that, we will be outreaching to members to invite them into this, to work with this team as well. When they come in, the advocates will do an in-depth assessment of the member's social needs and then create a care plan that's specific to each member. And then based off of that plan, the advocates will use Unite Us, as I just described, to help identify available resources and then connect the members to those resources. Sometimes there aren't resources available everywhere throughout the state for every specific need. So when that happens, then the advocates will go even further and really research to try and find resources that may not be just very readily available and really help to close the gaps for those members. And then the advocates are going to follow up with the member after 30 days, just to ensure, they got the assistance that they needed. If they didn't, and if that resource didn't work or help, then if the member wanted, we would just start that process all over again. Next slide, Rose. This is an example of the forms that we have on our website. These forms are really aimed at gathering additional data about members. So one of these forms asks a lot of SDOH questions. The other form is the Real D form, which collects race, ethnicity, and language data. And then the SOGI form, which is sexual orientation and gender identity. And so then when members can come in, complete these forms, and then that information comes into our systems. And so, for example, if a member indicates that they like to use different pronouns, then that's going to be used as an alert. So when they call into our navigator team, it's going to alert the navigator that this member has these chosen pronouns. And then all of that information then comes in to our personalization engine and feeds into our recommended programs. So it's just kind of this big cycle and circle. Next slide, Rose. I want to close on some focus groups that we did. And we did these to really try and learn how members are interacting with the benefits and services available through our MODA 360 program. We did 9 focus groups, and we did a mix of MODA members and non-MODA members. So some of the members that were in the focus groups were aware and familiar with MODA 360 and the services that they have, and others aren't even familiar with MODA. So a wide range. They were 2-hour Zoom sessions with the cameras on. And there were a few things that we found. One is that members find value in personalized aspects of MODA 360. Members were most enthusiastic about the personalized program offerings. Though one thing that was clear is that some members really had some distrust of how personalized things truly were. A lot of people just thought, oh, this is just a generic care reminder, or it's just a generic program that you give to everyone. Members also identified that they really liked the behavioral health champion and that really resonated with them. And I think part of the reason for that is because access to behavioral health services right now is a hot topic, and it's something that a lot of people are struggling with. So during the focus groups, when we were talking about the champion and how they help connect members to the behavioral health resources. Members were very enthusiastic about that. And then we use these focus groups to make changes to our member dashboard off of the feedback that we got. So we moved placement of some things, we changed language. I'm really trying to make that experience better and easier for our members. Next slide, Rose. And that's it. Thank you for having me. Any questions?
Open the floor up. All right. Sounds good.
Well,
It's a
thanks
good
so
review
much.
for some of us, and a great introduction for all the things that MODA does. Appreciate that. All right, Sapari, what's your status? Should we jump something, or are you good?
Thanks, Bill. Yes, we are good. So we have Jen Cole, our program director for person and family care, on the line. So she will be taking us through the presentation today.
All right,
All right.
let's go. Let's do
Thanks.
it.
Thanks, Safari. Good afternoon, everybody. My name is Jennifer Cole, and I am the Program Director in Consumer Experience in Person and Family Centered Care. And I am responsible for patient engagement strategies at Kaiser in the Northwest. Can you please advance the slide? So we're going to pick up the conversation that was had in 2023 and look at how the Northwest is listening to our members. So our feedback measures remain the same type of tools. However, you will see that we have an uptick in satisfaction with video visits and phone appointments, and we're holding steady with in-person visits. Can you please go to the next slide? Now, what we are doing with that information we get from our members is we are looking to improve the care experience for all members in our population. So these are 5 focus areas that we are looking at this year extensively to improve our experience. First, with primary care and appointment availability with your primary care physician, we heard that patients want appointments with their own PCP. So what we've done in 2024 is add a capacity of 9.6 FTE of panel capacity, patient visit capacity, so that patients can see their preferred care provider, really leveraging that relationship they have with their primary care provider and that history, and allowing them to have that comfortable experience. We're also looking with that same kind of focus at specialty care. And we've heard that the wait for a specialty care clinician is beyond what is acceptable. So what we are doing is we've reduced the wait time for new referral appointments by 15%. And then we're working through a backlog, which we anticipate to be complete by the end of the year, so that there is much less, there's shorter turnaround time and less appointments accumulating, so that people can see those specialty care providers as after they are referred. For mental health access, we are looking to continue to reduce the backlog. We've already reduced the backlog by 72% by hiring more clinicians and creating panel capacity. For imaging, same, we heard our imaging access was not acceptable, and especially for real-time appointments. So what we've done is we added another scanner at Sunnyside, the Eastside Hospital, and then we also opened up a secondary or additional imaging site in Thurston Way in Vancouver. So what that does, it allows us to spread out appointments over more panels, more time, and it also reduces the commute for those patients in those areas. Lastly, not really lastly, but lastly, what we'll talk about today will be enabling equitable care. And what we have heard is that our patients of color, non-English speaking patients, are reporting a poorer care experience than their white English speaking counterparts. So what we're starting to do at Kaiser is take some deep dives into those member journeys and look at that experience data and looking to identify interventions that we can operationalize this year. Can you please move to the next slide? So to further talk about,
I'll just jump in. I would just say those things on the
sure,
last
sorry,
slide.
sorry.
From the clinician standpoint, do feel real and substantial when we improve the match of patients with their own doctor, or when my patients are more likely to see me and less likely to see my colleagues, and I'm most likely to spend most of my day seeing my own patients, we know that improves the patient satisfaction with care, and it reduces our burnout and exhaustion as well, because we get energized by people that we know and respect and have mutual trust for. And we can just see the improvement in specialty care, being able to directly book people, how delighted they are when they don't have to wait for a call back to get an appointment. And that appointment is just really set up at the time someone's seeing us, whether that's in primary care or their behavioral health program as well. So it's just saying the numbers are moving in the right direction, and I can tell from my viewpoint, seeing patients every day, that we are making progress on those first 3 in particular, and the next 2 are on their way.
Thanks, Doctor. Sorry about that. Moving on to the next slide to pick up the conversation about enabling equitable care, I'd like to highlight 3 areas that we're working on this year, one of which will be an update. We are working on designing care for equitable experiences for our members, and we'll go into a little more detail about what that means to us and how it impacts our members positively. It's really environmental and experience changes driven by answering the following questions: how I see myself, how do I engage, what's my experience as a patient and a person, and what are other people doing in this space. Moving on to something else, we have elevated this year Spanish language focus groups. So we have 100% Spanish speaking focus groups, meaning the clinicians, the care experience, consumer experience staff, and the members are all, it's conducted in Spanish. We are partnering with our Salud en Español modules to create that connection. Members are sharing their lived experience and their feedback. And we are making connections with populations we typically don't hear from in those typical survey tools. They're expressing gratitude and really demonstrating on this scale that they want to be involved more, but want to be involved in what's important to them. So that sense of community, connecting through Salud. And then we have intentions of wrapping around some more interventions with those focus groups, whether they're wellness activities, group meditations, recipe swapping, really some not necessarily clinical, but more whole person care as they're there at Salud to feel connected to their healthcare and their community. Lastly, an update on the Center for Black Health and Wellness. Opening in July 2024, July 2024, physicians and clinicians are in onboarding as we speak. Really looking to combine the perspectives of member employees, member employees of color, members of color, and also key community partners as we look to develop this resource for care for our members of color, and making sure that we get feedback and are using their feedback in designing processes, environment. So far, our weekly blood pressure clinics are receiving very positive feedback. Doctor, did you want to add anything to that?
No, we're excited about all of these things, the tangible aspects of the Center for Black Health and Wellness in Northeast Portland. We think is great. We think there's a great opportunity. We know it's not just about care experience, it's also about care quality, and those things really are one and the same. I will say for the OEB population, when we look at care disparities, at least clinical care disparities by race, ethnicity, they're fairly attenuated compared to the rest of the population. So the OEB population is somewhat, we don't see large amounts of disparities, and we do see slight trends, but they're pretty trivial compared to what you would see in a different population. So there's something about the nature of the OEB population, perhaps being multilingual or multicultural, or just interest in preventive care and chronic condition management does tend to attenuate that for the OEB population, but we still see it to a certain extent, and we still see it in the rest of the population, and it's still really important work. So thank you to the board and to the state for your encouragement and stimulation to keep these programs moving and demonstrate their effectiveness.
Thanks. Next slide, please. So diving further into enabling equitable care, I spoke of those 4 questions. Here are some of the more tangible actions that we're looking at under each of these themes. So we are looking to provide I Need an Interpreter wallet cards for our members, and that is in their native language or preferred language and in English, that they need an interpreter or wallet cards that they can carry with them to use at our pharmacy, imaging, other ancillaries, so that they can be autonomous and guide that conversation without having to rely on some language skills in which they might not be confident at that point of service. Also looking to really have environmental walkthroughs and assure that our surroundings and our environment are supportive, so that members can see themselves, and that also that they are a welcoming space for care and recovery where we need to create that environment. Thinking about resources for our members, reimagining our, what I'll call the bulletin boards or resource centers in our primary care, and also all across ambulatory care and even in our hospital settings, so that we can celebrate Heritage Months. We can also look at community resources that are relevant to the patients in that particular, visiting that particular line of care. Moving forward of how I engage with care is looking to establish baseline care for our interpreter services. Everything from, do we have the equipment up and running? Are staff well trained? What are some baseline following utilization rates? Reviewing patient instructions for literacy level and language options, making sure that we are communicating to our members after they should leave that care experience. Offering members pastoral and spiritual counseling options in ambulatory settings for people who really find that meaningful and useful in their treatment. Going to trial what I'll call caregiver instructions, so that it's a non-clinical tool to support community and familial-based care, because oftentimes we see families present or caregivers present with patients. Moving on, we look to see what our experience is as a patient, as a person. So we're creating a day in the life, which will allow us to look at some community data overlaid with some electronic medical record data to really create a viewpoint of what our members experience outside of that treatment. So who might be more inclined to have transportation challenges? Where might we see some employment instability? Where might we need to lean in and provide some additional support? Specifically in certain treatment programs, we're looking to rethink our social support conversations to guide with the equity lens, not assumptions of need. If you are in radiation oncology in the ambulatory setting, that's a long haul commitment, whether or not you have easy access to transportation. So just having those conversations through that equity lens and not assuming need. Increase awareness of our diverse mentorship population, and then also in areas where they're not, really look to engage our patients to provide peer support. Lastly, as we look inside and outside Kaiser, so looking across our population health, community health in our market, looking at other markets, what they're doing, and then also sharing, better and best practices with external organizations. So maintaining partnerships so that we can apply tested interventions that work in all populations. Can you proceed to the next slide, please? So how does this manifest? How does this show up in our care? For our radiation oncology patients who in the ambulatory setting who are provided one complimentary wig during their radiation treatment, we are now providing natural hairstyles and religious head coverings in that setting. We're also including interpreter services in that space too, so that members can communicate in their preferred language and be able to find hair styles and head coverings that are natural and look like them, so they can see themselves in the care. Additionally, that staff is going to be trained in the care and fitting of those, and we are also connecting with community resources to come in and be able to provide us resources on where our patients can go get those cared for in certain salons by zip code, so that they can know where to get that support after they leave our clinic. We're going to, and we already have had our second Spanish focus group, and we're scheduling a third so that we can review patient instructions that we've been updating for certain departments. We're collaborating with our cancer support line for proactive outbound outreach to close gaps for social needs prior to that first treatment appointment. There's typically about maybe 1 to 2 weeks between when that first appointment is to when the first treatment is, whether or not you need to have a fitting for a mask or something of that nature, or just need to get all of your pieces coordinated. We're going to make outbound calls to patients that we think might be at risk so that we can close those gaps. And even for patients who may not have gaps, care gaps, help them navigate their FMLA, help them navigate their time off at work, connections to counseling and social work, connections to community resources. Where can we support them? Again, wrapping around that clinical experience. And lastly, I've referred to that we are also reviewing our patient instructions, and we are going to ask our Spanish focus group to help us review them. So these are some of the initiatives that we already have underway this year, and looking to get feedback to build more so that all members can see themselves in care, because we're really looking to create an experience that wraps around technology, process improvements, excellent clinical care, so that we can assure that our members are perceiving an improved experience where they see themselves in authentic and meaningful ways. Next slide, please. So, are there any questions?
Open the floor.
I would just add one thing. I mean, we focused here on the consumer experience, but I think that's really another lens into our social need work and our health equity work, because they're really overlapped. What an individual needs and how they rate their consumer experience or what they need from healthcare is so much dependent on the other rest of the context of their life. So we didn't focus on that today. We've presented to the board about that several other times, but I would say that those are really overlapped activities that we're doing that are really important. Innovation, a really important trend in how we think care should be delivered and received. You agree with that, Jen?
Totally.
Yep.
And when I think of when we design for the margins, we design for everyone.
So when you're doing this, I see the things you're opening up the new clinic and doing the better instruction focus groups. It's just your metric is going to be your customer satisfaction survey of people of color. Is that the target for measuring just how these outcomes are going to benefit everybody?
We will, longer term, yes, we will look at our experience scores for those areas where we are pursuing these interventions. And we'll also look for upticks in patient engagement from populations we're trying to reach in many ways. So if they want to participate in surveys to give us feedback, if they want to participate in one-on-one groups, we'll also look to see the attendance and adherence to our Spanish focus group and potentially the expansion. Ideally, we can roll that over into other languages and other support groups for our physicians that have high panels of non-English speaking patients. Look at interpreter services utilization rates from the baseline that we're going to get pre-intervention, post-intervention, and definitely do real-time rounding to get qualitative and immediate feedback from patients.
So all those things plus the data systems that were reviewed in the second slide there. It says feedback measures across a variety of viewpoints, which includes CAPS, new member scores, medical office visit survey, dental office survey, and then real-time feedback through a QR code. All those things are being used.
Nice.
I think that the variation by race, ethnicity, and language, we're using the medical office visit or Press Ganey scores for that.
Okay, great. Any other questions from the board? All right, seeing no hands up. I'm looking at
And you know what? I want to call out the spiritual counseling or pastoral care and ambulatory care. That is like a no-brainer. I've never thought about that before. So it's something that's sort of routine in hospital care, but we haven't really done that. And that is a really important aspect of healthcare that I'm not super comfortable with, but it certainly comes up. So having that resource for people who are dealing with serious illnesses or dealing with mental health problems, the whole aspect of pastoral care and spirituality, bring that. It's part of what it is to be human, and it's powerful medicine, and it amplifies and maybe the right inroads for certain people for certain kinds of conditions. So kudos for the team for thinking about that. I hadn't seen that before.
it's kind of an add-on to counseling, right? It's
Yeah.
just a specific type of counseling. Yeah. All right, board. I'm actually looking at like 25 minutes more, and I'm inclined to just power through and end early and give you some time back in your life, especially since it's my first meeting as leader to achieve such a goal. Wow. So I'm going to go ahead and just speak up if you need a break. So I'm going to go right into budget update for Molly, which is the last part of the packet.
Yeah, you bet. Thanks, Bill. This is attachment 7, and today we'll be focusing our semi-annual budget and financial update on 3 areas. We'll look at the status of OEB's 2023 to 2025 legislatively approved biennial budget, which is how we budget in the state. And second, we'll take a historical look at our claims paid over the past 4 years and how it has impacted our funding position with MODA specifically. And third, we'll take a look at our cash reserves, also known as our stabilization funds, which I know you've been hearing a lot about in the renewal. So starting with our OEB budget and expenditure slide, this report is through March 2024, which is about 38% of the way through the biennium, or 9 of 24 months being reported. On this slide, you'll see our 2 budget structures. One is the stabilization budget, which is almost $2 billion, and the operations budget, which is about $20.9 million. So about 99% in stabilization and 1% in operations. The stabilization fund budget captures all expenditures going out to carriers for benefits and claims costs after bringing in premiums. Obviously, premiums are revenue from participating entities and self-pays like retirees and COBRA members who pay for their benefits directly. The operating budget captures expenditures for staff personnel costs, consultant costs, system maintenance and development costs, and other operating expenses. As you can see in the stabilization fund chart, through 38% of the biennium, we've expended 35.3% of our budget, so under budget so far, all good. The same holds true for operations, where we've expended about 36.2% of our biennial budget, so also slightly under budget there. Next slide, please. On the next 2 slides, we'll take a look at the MODA dental and medical claims fluctuation over the past few plan years. We'll take a partial look at the 2024 plan year through 6 months as well. You might remember last year when we did a deep dive into the minimum premium financial model with MODA and explore the reserves. You also might remember that Kaiser plans are a more typical fully insured plan and funding model where OEB passes through premiums collected over to Kaiser. This is much different than the minimum premium funding model with MODA. So stay with me through this, and please feel free to ask questions. We generally, I think in the fall, we'll get into a little bit more detailed report led by Kirsten and Mercer. So starting on this slide with the MODA dental claims, you can reference the 2 bars as the maximum claims liability, which is known in a minimum premium arrangement as the premium. And the next bar over is the gross adjusted claims, which are the total claims paid, net any adjustments. So for example, if you look at the 2021 plan year, we collected more in premiums than we paid out in claims, which resulted in a $5.3 million surplus, which is the line represented as the claims liability balance, which means the ending balance for the year. So in fact, the surplus is realized in every year on this chart. So far, we are in a slight surplus for 23-24 as well through 6 months, as you can see on the far right. Next slide, please. So this next slide is showing medical claims versus premiums, similar to the last slide showing dental claims versus premiums. And you'll notice we had a surplus in years 2019, 20 and forward. We are also in a surplus through 6 months into 23, 24. The takeaway is that the pandemic really moved OEB into a surplus territory, which has continued through this year. So the minimum premium funding model is doing very well. Again, I think the pandemic really, was challenging in many ways, but maybe not in as far as the minimum premium funding model for OEB. It actually moved the plans from a negative position into a surplus position. Any questions on that so far? Okay, next slide, please. So this last slide shows our reserve cash balance reported through March of 2024, which sits at about 70 million. This is comprised of mainly two pots of money. So the rate stabilization reserve funds, RSR funds, at 19.8 million, which was generated from the Senate Bill 1067 hospital cap savings, and the OEB stabilization reserve, which has slowly been built up over the years with interest earnings, admin budget savings, and some federal investment funds. The RSR reserve is a current balance and does not include the funds obligated by board decision for the 2024-25 plan year, so it'll be a little bit lower. Although interest earnings are quite a bit these days. For several years they were next to nothing, and now all of a sudden we're getting some significant returns on interest earnings. The RSR and Stabilization Fund Reserve is much different than the medical and dental cumulative claims liability balance. You can see that note down below of 117.6 million, which is noted there at the bottom of the slide. The cumulative claims liability balance is a surplus position right now, but it can fluctuate dramatically month to month depending on claims experience and is subject to paid for claims run out upon termination of the contract. So, which is why we don't really include it as an in a reserve category, but it's not really for buying down rates. So we still want to report it, but again, it's far from being a reserve. It's really more set aside for claims run out and then seeing kind of where things are at if the contract were ever to terminate. So we will continue to keep the board updated on our reserves at the fall retreat. With that, I'd be happy to entertain any questions. I know that's not the easiest way to end a meeting on with financial information, but yeah, the takeaway is things are going really well right now for OEB. And Kirsten, feel free to speak up.
Just starting to see the rollout.
Yeah,
just starting to see the rollout after the pandemic as things see how things are stabilizing out with the new budgets and things. So it's kind of interesting to see that. We spent 2.5 years wondering how coming out of the pandemic was going to look like and conservatively adjusting for it. And now we're starting to see just what that reality is. Open floor for the board. All right, not seeing any hands up. Why don't we go ahead to our fall agenda preview? Do we need to, Ollie, mention that we've got our summer work group put together? I know an email went out. Summer work group will start this month, I think, with some online meetings, 2 meetings a month. Did anybody not understand the summer work group? Questions now? I'll add that to the agenda quickly. They're going to discuss medical care workers. Right. All right, I don't see any hands up. So let's go to Kirsten talking about the fall agenda preview.
Great, thanks, Bill. Before we turn our attention to the 24-25 plan year, Mercer just wanted to take a minute and thank everybody on this call who's given their time to OEB over the last year. So thanks to you, board members, for the time, attention, and care that you've given the OEB members by serving on the board. And to some of you also for serving on the CIAL committee, the Health Equity Committee, the IWG committee, and also the summer work group. Bonnie and Sally have volunteered their time over the summer for the summer work group, so we're really grateful for that. Thank you very much. Thanks to you, Ollie and Damien, also for your thoughtful leadership and support. We want to make sure to thank our dedicated OHA staff, and we started off the day today with a demonstration of how tremendously successful that is to OEB members, one aspect of it. We also want to thank Margaret and Glenn, Cindy, Sharna, Linda, Georgianne, April, Ruby, Brian, Rosie, and other staff members. We really value your deep expertise and commitment to OEB members. Thank you to you, our carrier partners also, MODA, Kaiser Permanente, Willamette Dental Group, VSP, The Standard, and Weight Watchers, to name a few, for your collaboration and especially for your willingness to be pushed. The work that we've accomplished together over the last year truly was a team effort. Ollie, before I move on, do you want to say anything as well?
I think you said it perfectly, Kirsten. We can't thank you enough. I mean, today we're really shorthanded with Tom's retirement, and every board member showed up, and we can't thank you enough for that dedication and making time for OEB and making it a priority in your daily lives. And it's definitely something that we value and really cherish. And we just really hope everybody has a wonderful summer.
Wonderful. So let's just take a brief look at the fall agenda for next year. Just a quick note before we actually start talking about some of the agenda items. So we're going to have some new board members joining us next fall. And of course, we've had some new board members join us recently this last year as well. So that year will be a little bit unique in that we'll want to take some time at the beginning of the fall to really level set and get everybody onboarded. And because there's a little bit of a question around the timing of when exactly our new board members will begin attending meetings, the exact timing of the agenda items might fluctuate a little bit, maybe get pushed back a month or so as needed. But in general, this just illustrates kind of the main things that we want to talk to you all next year. Of course, we want to spend time getting to know each other, meeting our new board members, introducing all of our carrier partners and vendors and support staff, OHA staff who help out to make OEB and PEB possible. We'll want to learn a little bit more about OEB and some important features of OEB's history, and then also recap work that was accomplished for the 23-24 and the 22-23 renewals as well. And then we'll have an annual fall retreat in October and November, all together in person, which will be a wonderful opportunity to see each other. But we're going to refresh OEB's goals because it's been 2 years since we came together at our first fall retreat to set those. And we'll also identify the priorities that you all want to accomplish during the 25-26 renewal. And then in December, we will officially kick off the renewal process by putting all of the things that we discuss and you ask for in the retreat in the formal renewal letters that go out to our carrier partners. But for now, we just simply want to wish you all a fun and rejuvenating summer holiday. And unless you are Bob or Susan, we will see you next fall. So thank you.
All right. Thanks, Kirsten and Mercer team. Let's see, Rose, do we have any public comment?
No, you don't have any public comment.
Okay. And so I just want to chime in and say, as I'm coming in to another year of OEB, we're finishing out this plan year. Just my also thanks for everybody who's participated in OEB and the board, and especially thanks to Sue and Bob. Long-time discussions, many years of discussions about this and other activities as school boards leaders and school board member. Really appreciated your time there and your time in getting to know you and getting to work with you. let's see, we're not having a meeting in July. Is that correct, Ali and Damien?
Yeah, July and August. Yeah.
July and August, no meeting. So our next meeting will be in September, our usual second Tuesday for that. And we'll be doing some work over the summer with the summer work groups and also working on reconstituting some CIAO membership as well, because we've lost 3 of our 4 members for CIAO. Two of our 4 members for CIAO have gone away. So we'll be working on that over the summer and reaching out to people for that participation in CIAO. And that would be the mornings of the board meetings. So it makes Tuesday an all-day affair for the first Tuesday of the month. Otherwise, not any open business, any comments from anybody? First
So we
Tuesday
do,
of the month. Yeah.
we do have
Go ahead.
recruitment letters out for Tom's replacement. And I know there's a lot of work going on to replace Sue and Bob, and which is not an easy task, but hopefully we'll be as lucky as we were with Cheryl and Sally. So I'm sure we'll get some good new board members, and it'll be exciting time to regroup in September.
All right, and with that, thanks, Bob. Thanks, Sue. I get to do my first board meeting by saying we're giving you an hour and 5 minutes back. Hopefully this will be the new trend, right? No, just kidding. Right. It will not be the new trend. Right. All right. So thanks everybody. And it was a great year for OEB in the work we did this year. Just congratulations to everybody. See you all in September, and I'll see some of you over the summer. Right. Thanks everybody.